Now, as we kick off the week, Newzroom Afrika is providing what is an in-depth coverage throughout the day on the growing obesity crisis in South Africa. We begin with what is a concerning report. According to the Human Sciences Research Council, that's HSRC, more than 50% of South African adults, over half, are now classified as overweight or obese. This rising trend has sparked alarm among health experts who are warning of the long-term implications for the country's healthcare system and the overall well-being. AM Report is taking a closer look this morning at the rising prevalence of obesity. And to help us unpack this, we're joined by Dr. Chantell Witten, who is the Health Systems Director at iLifa, Labantwana. Dr. Chantell Witten, thank you so much for the time. Really appreciate it. Let's talk about the most prevalent reasons for obesity across the country, if you will.
Good morning, and good morning to the listeners. Well, let's start where it begins. So obesity, we measured it obviously in children and in adults, but it actually starts in the womb. So when we talk about maternal nutrition, that's the state that the mother is in. Her nutritional status then affects the growing baby. And that obesity gene is already laid down during pregnancy.
So basically you're saying if the parent may not actually have been obese, but then changes their eating habits, and that habit then gets drawn in to the child then at a later stage?
Absolutely. What we're talking about is something called epigenetics. So how you eat, what you eat as a mother. And we also now from research know that as a father, the father's nutritional status also programs the future infant. So that fetus that is being developed is affected by the genetics of the parents as well as the eating habits of the mother. Now, remember, when our moms are pregnant, we have these local, call them expressions, eating for two, eating more to get more. And so we see that our pregnant moms do not have optimal nutrition, do not have good dietary practices, which is reflected in the home, Simpiwe. So this is what happens, is that our dietary patterns for children is already programmed in the household. So how the parents are eating, how the family around the child is eating reflects in the child. So we see both childhood obesity, and what you are talking about is what we see later on as adult obesity.
So that just means we're probably just not as aware as we should be of the different kinds of obesity that actually relate.
Also, South Africans are not very, what we call, don't have a high level of nutrition literacy or food literacy. So what to eat, how much to eat, and when to eat are very important elements of a good diet. And then when you talk about the different types of obesity, this we do with measurement. So when we measure, I'm going to explain it in terms of children, when we measure children with their height and their weight, if they are too, let's say, too heavy for that height, then they are overweight or obese. We also measured it with our children that go to the clinics. We put them on the scale every month, and we can show you the height and the weight according to the growth curve. So every child in South Africa is born, and they are given a Road to Health booklet. And in that booklet, we have a growth chart. Now, if your child's weight chart is getting too heavy for the age, we also call that overweight.
That, at a later stage in adults, relates a little bit, if I'm correct, to the BMI index, right? The body measurement index. How accurate is that then? And should we be using that as a clear measurement of obesity? Because some have said that perhaps it isn't as correct because of things like bone density and the like.
Well, no, we use the BMI, which is your index, which is your weight according to your height. And it's very easy to do it. So you take your weight in kilograms and you divide it by your height in meters. So if you're 1.56, like I'm 1.56, you multiply 1.56 times 1.56, and that number that you get, you divide it into your weight. Another easy way to do it is you take your height in meters. So I'm 1.56 in meters. I change that. It becomes 156 centimeters and I minus 100, then my ideal weight would be 56. So if I'm weighing
Wow.
60 kilograms at a height of 1.56, I would already be overweight. So you can see how sensitive the BMI is based on your weight according to your height. So if you take your height in centimeters minus 100, that's your ideal weight.
So how much can we sort of trust that data? I mean, I'm going to do it with myself here, and I'm willing
Yes,
to do
please
that.
do it.
I'm willing to do it with myself here. It says
Yes.
I should be. It should be. If I'm 1.81, that's
Yeah, so you should be
181.
81.
So I should be 81 kilograms.
Correct.
I can guarantee that I'm currently 20 kilograms above that on its own. So does that effectively then make me obese? And does that then say to South Africans, we need to be able to get ourselves to that lower level ASAP?
Absolutely, Simpiwe. You are obese because what that means is that you are far too heavy for the height. Now, remember, your body is designed to carry. You talked about bone density, which is another measurement that we use. And that measurement I'll talk about a little bit later. But your structure is designed to carry a specific weight. Your ideal weight is this 81 kilograms, which means that your body is not working as hard. Your body is not taking on those knocks, wear and tear. It doesn't have inflammation. But at 100 kilograms, your body is overweight. And therefore, you have a lot of what we call endocrine functions that make it hard for your body. So you're going to have pains in the joints because of your inflammatory response. Obesity is a cause for inflammatory. We know that obesity causes high levels of cortisol. We know that obesity has a high let's call it weight bearing on the bone. So it can be good for bone density, but it also can cause bone fractures. So if you fall, you are more likely to get hurt than if I fell. So at my 156, I should be 56 kilograms, but luckily I'm just above that. I'm at 58, which is putting me on the border of becoming overweight. So the closer I get to
Wow.
60, the higher the level of my obesity, right? So we want to keep close to the 56 and even below the 56, and then we have a better BMI.
Okay, and I know I'm concentrating on this a little bit. I just want people to perhaps be a little bit more educated on this one as well. So this is an accurate measure ultimately of where you should be in terms of overweight, obese, etc. Does that ultimately then put people at a worrying state? Because, for example, if now that I've figured this out, for example, I sit back and I think to myself, oh, woe is me, I get depressed, and then I go and eat even more and make myself even further. Is that not the worry here, that it creates that ultimate cycle of people just continuing to be obese because of it?
Yes, and there's a lot of research that tells us that what we are eating influences our brain, influences our state of mind. And what you're talking about is the vicious cycle of your psychology influencing your eating habits. And you've called it, I get depressed, or I'll get upset about my weight and therefore I'll eat more. So that binge eating, that psychological eating is a problem, and we understand that. But this is why you have companies that have programs, loyalty programs, that actually incentivize you to do good lifestyle behavior. Go and exercise, buy the right foods, spend more time with your family, try to relax more on this holiday. So we have these programs, both in public sector as well as in the private sector, trying to push us towards the right healthy choices. And one of that area is understanding food so that you can make good choices around food.
Listen, Dr. Witten, my directors in my ear are basically saying, listen, I definitely am obese here because they're at the same height and they're 78 kilograms. So they're trying to make me jealous here. So I don't really like this this point.
They should.
But nonetheless, there are some people who talk about this and say that it's actually expensive. Being healthy is expensive because the foods you have to buy certainly can be expensive as well, etc. Whether it be fruits, whether it be vegetables, eating less sometimes costs more because of the types of foods you have to eat as well. What would we say to that?
Unfortunately, it is true. We have evidence from a number of studies that have done what they call food costing. And so when we look at the food basket, what we would like to see in that food basket is more fresh fruits and vegetables, is high quality meats, is more variety. And all of this, unfortunately, in South Africa is costing us more money. And we have a very experienced group called the Pietermaritzburg Economic Justice Forum. They do the food costing of an ordinary basket. And we know that the cost of an ordinary basket, that's not even a healthy basket, Simpiwe. This is just an ordinary basket. It costs more than what our minimum wage is. So in South Africa, we have very high levels of food insecurity. Now that means too little food and too little high quality foods. So people are eating inferior foods. Let me give you an example. I would like you to have a nice piece of lean meat or lean chicken. But the majority of people in South Africa are not even eating meat. They are eating processed meats. So the Viennas, the polonies, in the tin, the corned beef, these are all processed foods. And these are very, very high fat foods. And fat makes us fat.
Whew. Dr. Witten, very finally, GLP-1 drugs, those entering quite a bit then in South Africa's world of health, shall we say then. The prevalence of that as a healthy option, as helping people lose weight fast, how helpful is that at present?
I am a health professional, so my recommendations, my advice to you is please speak to your health provider. Please speak to your doctor. Please speak to your endocrinologist. As you have indicated, the HSRC's data shows us that 60% of our people of the adults are either overweight or obese. That is a medical condition. We do not mess with medical conditions. Do not self-prescribe. Do not take on other people's medication. Do not take information from social media. Please go to your doctors. Medication should be given by medical personnel, such as your doctor, your pharmacist, your nurse, your dietitian.
Dr. Witten, I'm hoping the next time we speak, I'll be 20 kilograms lighter and officially within my BMI. Whew, I'm obese.
I'm looking forward to celebrate with you.
Oh, this is going to be interesting. Dr. Chantell Witten, appreciate the time then this morning here, joining us as we unpack just the high prevalence of obesity in the country. 50% of adult South Africans are overweight